Hey everyone, and welcome to a deep dive into, Malaysia's health insurance situation. It's a little complicated right now. Premiums are going through the roof, and policyholders are definitely feeling it. But here's the thing. Private hospitals, they're posting these record profits. So are these two things connected? And what is Bank Negara Malaysia doing about it? B&M for short. We're going to try to break it all down.
It's a pretty interesting situation, yeah. You have policyholders struggling to afford coverage, and at the same time, private hospitals seem to be doing really well. It kind of shows you that conflict between affordable healthcare and the business of healthcare.
Exactly. It does. And to break this down for us, we have Dr. Mohamed Rafick Khan Abdul Rahman. He's not just a medical doctor. He also knows the ins and outs of the insurance world. He's worked in both. So that's a pretty unique perspective.
Yeah, definitely. Having someone who understands both sides, like the medical side and the financial realities, it's really valuable for this conversation.
Absolutely. All right, so let's dive into B&M's response. They've put out some interim measures that basically try to soften the blow of these premium hikes. So insurers are now being asked to spread out premium increases over 3 years. People over 60 get a 1-year freeze on increases. And insurers have to offer alternative plans, which I guess means different price points. So it sounds like they're trying to make things a little easier on policyholders,
I
right?
mean, on the surface, yeah. But Dr. Rafick has an interesting point. He suggests that these measures might just be a temporary fix, not a real solution. He even argues that they could actually make policyholders pay more in the long run.
Wait, how does it work? How could it cost more?
Well, it comes down to healthcare costs themselves constantly rising. Think about it. Inflation, new technologies, an aging population, it all adds up. By delaying the full impact of these premium increases, we might just be putting it off. Sure, you might see a smaller increase each year, but over those 3 years, you could end up paying more in total than if you just had one bigger increase up front.
Okay, I get it. It's like paying off a debt sometimes. Those smaller payments mean you end up paying more in interest overall.
Yeah, exactly. It's like a financial balancing act. And in this case, delaying things might not actually help policyholders in the long run.
Which leads us to the elephant in the room, the financial performance of private hospitals. We've got data here from KPJ Healthcare and IHH Healthcare, two of the biggest players. Their revenue and profit growth are, well, let's just say they're doing incredibly well.
Yeah, it's true. And this is where it gets a little ethically complicated. When you see profits in healthcare growing so much, especially with these skyrocketing insurance premiums, it makes you wonder, should healthcare be treated just like any other business that's focused on profit? Or does it have some kind of social responsibility?
It seems like everyone's feeling the pressure except for the private hospitals. Dr. Rafick actually compares them to a leaky faucet. As long as they can keep raising prices and see insurers as this like endless money source, no amount of premium adjustment is going to actually fix the problem.
He's got a point there. It shows how private hospitals don't have a real reason to lower their costs if no one makes them. If the money keeps flowing, why bother fixing the leak right?
So what can be done? Dr. Rafick has some interesting thoughts, and he starts with the insurers themselves. He suggests offering more reimbursement-based products. So it's like you pay for your medical expenses up front, and then the insurer reimburses you up to a certain limit.
That's a pretty compelling idea. And what's interesting is how it could change things up. With cashless plans, which are pretty common right now, people might not be as aware of what their health care actually costs. But if you're the one paying upfront and then getting reimbursed, you might start to question those bills. You might even look around for more affordable options.
You're more invested in understanding those costs and maybe even finding ways to save. And that could then put pressure on hospitals to be more competitive with their prices.
Exactly. It brings in a level of awareness and market forces that could help with those rising healthcare costs. It's like you're suddenly part of the game, not just watching from the sidelines.
Dr. Rafick also suggests that insurers could team up and negotiate with hospitals as a group. Imagine how much bargaining power they would have.
Strength in numbers, right?
Yeah.
It's a classic negotiation tactic, and it could be really effective here. Instead of each insurer going at it alone, they could work together to get better pricing for their policyholders.
It's not just about the insurers, though, right?
Well,
Bank Negara Malaysia and the government have a big part to play, too.
oh, absolutely. They're the ones who set the rules. And Dr. Rafick has some pretty bold ideas about how they could change those rules to make healthcare more affordable for everyone.
Well, let's talk about those ideas and see how bold they really are. But first, a quick reminder that you're listening to The Deep Dive, where we take a stack of your sources and break down the most important stuff. Stick around, because next time we're diving into Dr. Rafick's recommendations for B&M, and we'll see how those could change the game for Malaysia's health insurance system. All right, so we're back, and we're going to dig a little deeper into Dr. Rafick's analysis of Malaysia's health insurance situation. But before we get to his recommendations for Bank Negara Malaysia, there's one more thing we got to talk about.
Yeah, it's something that's been getting a lot of buzz lately, especially from the policy folks. It's called diagnosis-related groups, DRG for short. It's this payment model that some countries use to try to get healthcare costs under control.
Okay, so how does DRG work?
Well, imagine you go to the hospital for, let's say, a knee replacement.
Right.
Right now, the hospital bills you for like everything separately, the surgery, the anesthesia, the meds, the hospital stay, even the bandages. It gets pretty detailed.
So like a medical expense menu.
Exactly. But with DRG, things are different. The hospital gets one fixed payment for that knee replacement, no matter how many things they actually do. It's more like a package deal.
So one price for the whole thing.
Right. And the idea is that it makes hospitals try to be more efficient. If they can give good care but use less stuff, they could actually make more money within that fixed payment.
That sounds like it could help with the costs. But reading this here, it seems like Dr. Rafick isn't totally sold on DRG being the answer for Malaysia.
Yeah, he brings up a couple of good points. First, DRG usually works best when there's one payer, like when the government sets all the prices. Malaysia has public and private providers, which makes things a little more tricky.
Yeah. It's like trying to fit a square peg in a round hole. The model might not work here.
Right. And second, Dr. Rafick says DRG might not actually get to the root of why healthcare costs are rising in Malaysia. He thinks it's a bigger problem than that. He thinks focusing on things like changing the insurance market and being more transparent about healthcare pricing, that might be better in the long run.
So DRG could be one tool, but not the only tool. Dr. Rafick seems to want a more complete approach that really fixes the problems, not just covers them up with a new payment model.
Yeah, that's a good way to put it. He's looking for solutions that get to the core of the problem, not just the symptoms. And this brings us back to those recommendations for Bank Negara Malaysia. Remember, BNM is in charge of the insurance industry, and Dr. Rafick thinks they can play a big part in making healthcare more affordable.
Okay, so let's get into those recommendations. First up, he says to cap insurance company profits on health products. That's a pretty big idea, isn't it?
It is. It's definitely gotten people talking. But think about it. If insurers are making tons of money while people can't even pay their premiums, something's not right. Capping profits could maybe spread the wealth a little and make healthcare more affordable for the average Malaysian.
So it's like saying, hey, you can still make money, but let's make sure it's not at the expense of people's health and their wallets.
Exactly. It's about finding that balance between the insurance industry doing well and people being able to afford healthcare. It's not easy.
And he doesn't stop there. He also says to lower the capital requirements for health products. I know this is getting a little technical, but can you explain what those are and why he thinks they should be lower?
Sure. Think of capital requirements like a safety net. Insurers have to keep a certain amount of money set aside in case they have to pay out a lot of claims, like if suddenly a lot of people get sick.
So it's to protect policyholders and make sure the insurance company doesn't go bankrupt.
Exactly. But Dr. Rafick says the capital requirements in Malaysia are too high right now. And those high requirements mean higher costs for insurers. And guess who ends up paying for that?
Policyholders through higher premiums.
Yep. It's like a chain reaction. Higher capital requirements lead to higher premiums, and healthcare becomes less affordable. So if you lower those requirements, insurers might have more money to invest in other things, like making more affordable plans or keeping premiums lower. It's about making the system work better and cost less.
And then there's that idea of hybrid copay mechanisms. Dr. Rafick seems to really like those.
He does. Remember, hybrid copays are about sharing the cost of healthcare between the insurer and the person with the plan. So the idea is you wouldn't have to pay a copay for chronic illnesses, the ones that need ongoing treatment and can get really expensive. But for things like the flu or a sprained ankle, you would have a copay.
So it's encouraging people to get treatment for the serious stuff without worrying about costs, but also trying to prevent unnecessary visits for minor things.
Exactly. It's about being smart with healthcare and making sure resources go where they're most needed. Dr. Rafick thinks this is a way to control costs and make sure people get the care they need.
These are some pretty big ideas, and they're definitely going to cause some debate. But it seems like Dr. Rafick is really challenging how we think about healthcare. He's asking if profit should be the main thing in a system that's so important for people's well-being.
Yeah, he's raising some really important questions about healthcare as a business versus healthcare as a public good. And those are questions we need to think about carefully as we figure out the future of healthcare in Malaysia.
We've covered a lot, but there's still one more part to Dr. Rafick's analysis that we need to talk about: his thoughts on government hospitals and what their role is in all of this. So stick with us as we get into that and wrap up this deep dive in our final segment. All right, so welcome back to the last part of our deep dive. We've talked about what Dr. Rafick thinks about insurers, private hospitals, and even DRG. But there's one more piece of the puzzle: government hospitals.
Right. They're a huge part of healthcare in Malaysia, especially for people who can't afford private care. Dr. Rafick talks about this too.
So what does he say about government hospitals right now? Are they helping or making things worse?
Well, he definitely sees how important they are for making sure everyone can get healthcare, but he also thinks they could be better. One thing he suggests is to corporatize them.
Corporatize. What does that even mean for a hospital?
Basically, it means giving them more freedom to do things their own way, kind of like how private hospitals work. They would have more control over their money, their staff, even things like buying supplies.
So less red tape, more decisions made at the hospital level.
Yeah, exactly. Dr. Rafick thinks this could make them run better, improve the service, and maybe even attract more skilled people to work there.
Interesting. But wouldn't that also make people worried that they'd start caring more about profit than helping people?
That's a good point.
Hmm.
And Dr. Rafick gets that. He says there would need to be strong rules and ways to track their performance to make sure they're still focused on patients and keeping costs down.
So it's not just about giving them more freedom, but also making sure they use it responsibly.
Exactly. It's a balancing act. And this actually connects to his bigger idea about a healthcare system that's more integrated and fair. He sees these corporatized government hospitals competing with private hospitals, giving patients more choices, but still keeping things affordable through regulation and having a strong public healthcare system.
So both public and private hospitals would be trying to offer good quality care at a good price.
That's the idea, and it's a big and complicated idea. But Dr. Rafick thinks it's really important for making sure healthcare in Malaysia is good and affordable for the long haul.
We've covered a lot in this deep dive, from those rising premiums to private hospital profits, from DRG to government hospitals. But what does it all really mean for you, the listener?
Well, the biggest thing to remember is that Malaysia's healthcare system is at a turning point. There are real problems, and the solutions aren't simple. But there are people out there like Dr. Rafick who are really thinking about these things and coming up with new ideas.
It's a wake-up call for all of us,
Yeah.
the people making policies, the healthcare workers, the insurers, and even the patients, to talk about these issues and work together to make a better system.
Right. The choices we make now will affect healthcare for a long time. So stay informed, keep asking questions, and speak up, because your health and the health of the country depend on it.
That's it for this deep dive. Thanks for listening.